Hey guys, welcome back to the channel. So I'm still continuing on the series that I have about these non-medical, non-medication type of things that you can do as a caregiver, a non-medical caregiver that you can do in your home. And I preface all of these videos and all of my content and saying this also in writing to always consult with your medical team and always consult with your hospice providers and teams before doing anything with your loved one who's dying or who's ill. So let's go ahead and get into it today, and let's talk about some interesting things that you can do, especially in reference to when your loved one cannot eat. So let's get into it. When a loved one stops to eat and drink in the natural decline where they are going from very ill into that dying process, that is a very normal and expected thing. But it's really, really hard to experience a lot of times as a loved one, because as a loved one, food has so many meanings around it, with cultural meanings, holiday meanings, and just so many other type of social and other religious type of meanings, and so many other things behind it. So food has a lot of meaning to it. So when your loved one stops eating at the time of end of life, it can be really hard to adjust to that change. And what I want to say, which I really want to keep normalizing for people, is that it's really normal and really healthy to feel upset. First things first, I want to normalize how tough it is to see that as your loved one is declining and moving towards death, that they can no longer eat or drink. And what happens many times, at least in my 20 years of working with caregivers, working with seriously ill, either in the ICU or in hospice and palliative care, is caregivers first start to panic and they think, oh my gosh, what did I do wrong? Or how can we feed them? Let's go ahead and put a feeding tube in them, all that kind of stuff. But what I first want to say is just think about it from just a practical standpoint. When someone is dying, you're not going to be training for a marathon and pounding a bunch of protein. That's just not what happens. As the body's dying and declining, it's going through this natural progression of decline. And part of that natural progression of decline is the weakening, becoming no longer able to do things that they could do before, and losing their sense of self, becoming more sleepy and becoming unconscious, and then of course no longer being able to eat or drink like they were before. So this is part of a natural part of the natural course of the death and dying process. I go over kind of natural death and dying before, and I'll put another post up eventually, just because we just kind of need a reminder a lot of times on this type of stuff, because it's just really hard when we have an emotional attachment to somebody and we see these changes happen. And it can seem sudden sometimes for some people, when in reality, it's just part of that normal process. And the other part of food and fluids, especially if you're providing that for your loved one, it's a way of showing them that you love them. It's a way of caring for them. But so what I want to talk about today is, in those cases where they stopped eating and drinking, what can you do in place that is going to not only be helpful to you, but also very beneficial for your loved one as they're moving through this end-of-life process. First and foremost, and what I've always talked to families and caregivers about, was good oral care. And again, if you, anything I teach here and anything I'm going over, you really want to always talk with your medical team, your hospice team prior to doing it, because you want to make sure you're doing it safely. Oral care can be done, but if you're not careful, somebody could start coughing, the fluid could go down the wrong pipe, things like that. You want to be really careful. So keeping the oral cavity or that mouth really nice and moist and really clean. In the ICU, I would actually be brushing people's teeth because that was a really critical thing. It helped with pneumonia prevention, all that kind of stuff. And, but when I got to hospice, and even in the hospital, we used a lot of these we call them toothlets. They're basically a plastic stick with a little sponge, usually it was pink or green, a little sponge on top. Sometimes they had like a mouthwash kind of embedded in the sponge, and you can just dip it a little bit of water and wipe the mouth around it. You can certainly do that. You can take a soft toothbrush or even like a soft gauze and put a little bit of toothpaste or mouthwash on there and also wipe it. So what are these things that you can do when your loved one has stopped eating and drinking? Again, adjusting to that change. First of all, preparing for it if your loved one hasn't reached that point, preparing for that change. When it does happen, it's going to feel like it may be all of a sudden. It's going to feel maybe tough to experience, and know that you're going to have a lot of emotions around there. And it's not just normal to feel all these emotions like fear, anxiety, trepidation, and all this other stuff, anger. It's very healthy to have these types of feelings in response to these tough situations in life as you're losing someone. Because what does this ultimately mean? It ultimately means that this person that you're caring for, that you love, to whatever degree, that they are going to be going soon, that they're going to be dying soon. And for any of us, that's usually a hard thing. So let's talk about once they start no longer being able to eat, make sure hopefully you're working with hospice and let the hospice team know. Because they may want to come back, and reassess, ask some more questions, and also help determine kind of where we are in terms of the actual dying process. And from this point, somebody could live minutes, days, hours to weeks sometimes. That could even happen. Sometimes I've seen people live weeks and weeks on end without any food or water or fluids because of these other existential type of things that they're hanging on to. And I talk about that in other videos, things like spiritual distress, emotional distress, things like that. So, or you can, if you don't have any of that stuff, you can take a gauze, a clean gauze, moisten it and put some either a little bit of mouthwash or a little bit of toothpaste and, go along the teeth, on the outside, on the inside, on the tongue and on the cheeks, because you really want to keep that mouth moist. A lot of times too, when someone is in that dying process, they start to really relax the facial muscles. And so they'll start to breathe, but their jaw will be kind of very relaxed and might even be a little bit back, especially if they're laying on their side or their back. And so their mouth can get very, very dry. So frequent oral care, if you're there at home, doing it when you think of it, or at least every couple hours, because I don't know if you've ever woken up and, maybe you're congested in your nose and you woke up from mouth breathing and you're just, you're really, really dry. You're like, I need some water. Your loved one can feel like that for a really, really long time. So frequent good oral care, careful with the fluids. You don't want to drench these little sponges and things like that with so much fluid that it's going to get back in their throat and they can cough and stuff. You really want to be careful with that. And again, I'm telling you these things, but I really want you to be, to have the opportunity to be demonstrated by how to do this with the hospice team member. And then you can show them so that you really feel confident in what you're doing and how you care for your loved one there. There are some mouth moistening type of gels and stuff like that you can do. And even for people who aren't even who have really just stopped eating, they don't have an appetite, but they still want to have something and they're still alert enough to hold something in their mouth. A lollipop or even a popsicle is really nice to keep that mouth nice and moist. But again, if you're doing anything, if you're applying anything to your caregiver, to your loved one, you really want to make sure you're doing it the right way. So ask for instruction, do it with the hospice provider to make sure that you are not only doing it right, but also to validate what you're doing so that you feel really confident when you are doing it. Because we're all, the first time doing these things always feels a little bit antsy. And especially when we're dealing with someone who's dying, we want to make sure we're not doing anything to make things worse for them. So you're going to be okay. Just, talk with your hospice team, work with them. But oral care is really, really critical, especially when someone has stopped eating. So I'm going to just stick with that oral care part. And then again, if your loved one is still kind of awake or pretty awake rather, and is able to hold on to something, but they just really don't want to eat much, popsicles and lollipops, things like that can be really helpful. Make sure it's something that they can hold on to because you don't want it to get lodged or lost in the mouth anywhere like that. And it's really important too, is if you are feeding your loved one, that you really check their mouth and make sure that it's clean afterwards, because sometimes they pocket food. It's really, really critical because people, especially with dementia, weakening facial muscles or weakening swallowing, will tend to pocket food, meaning that their food just kind of pockets and kind of slides into these pockets of the mouth here, usually on the outside of the teeth here and between the cheeks and the teeth, or sometimes underneath the tongue, or sometimes between the lips and the front teeth here. So, and if you're listening to this, it's really just that whole bottom area of the mouth or the sides where it can really be pocketed under, and every once in a while, even under the tongue. And sometimes if the mouth is really dry, it can be even stuck to the roof of the mouth. So this is another reason why oral care, not just right at the very end when they've stopped eating and drinking, but all throughout the process as they are, moving through this process with you. Oral care is really, really critical, not just for preventing, worsening infections, skin breakdown in the mouth where you can get ulcers, but the discomfort, the episodes where they can cough and possibly choke on the food. But the comfort for them is really, really huge too, amongst all these other reasons I just gave you. They're so, so important. So oral care, regardless of whether they're unconscious or not, is still really critical and important. We'll continue with this series, but let me know if you have any further questions or tried anything else that have been really helpful. Put those in the comments. I will talk to you soon. Thank you for joining in. My name is Abigail. Let's continue to normalize these conversations and education about death and dying so we die better at the end of life. I'll talk to you soon.